High blood pressure, or hypertension, is a prevalent condition affecting millions of people worldwide. It can lead to serious health complications, including heart disease, stroke, and kidney failure. While various factors contribute to elevated blood pressure, including lifestyle choices and underlying health conditions, certain medications can also play a significant role. Many individuals may not realize that their prescribed or over-the-counter medications could be contributing to their hypertension. This video will explore 10 popular medications known to potentially cause blood pressure to rise, discussing their mechanisms, risks, and potential alternatives. 1. Non-steroidal anti-inflammatory drugs. NSAIDs, including ibuprofen, naproxen, and aspirin, are commonly used to relieve pain and reduce inflammation. While effective for short-term use, these medications can raise blood pressure, particularly with long-term use. Mechanism: NSAIDs can lead to fluid retention and reduce the effectiveness of certain antihypertensive medications. They inhibit the production of prostaglandins, which play a role in kidney function and blood pressure regulation. Risks: chronic use of NSAIDs can lead to hypertension in individuals predisposed to high blood pressure, particularly in those with existing kidney issues. Alternatives: acetaminophen may be a safer option for pain relief, but it's essential to consult a healthcare professional for individualized recommendations. 2. Corticosteroids. Corticosteroids, such as prednisone and hydrocortisone, are anti-inflammatory medications used to treat various conditions, including asthma, arthritis, and autoimmune disorders. However, they can lead to increased blood pressure. Mechanism: corticosteroids can cause sodium retention and potassium loss, leading to fluid retention and increased blood volume, which in turn raises blood pressure. Risks: patients on long-term corticosteroid therapy may experience significant increases in blood pressure, increasing the risk of cardiovascular complications. Alternatives: depending on the condition being treated, other medications, such as non-steroidal anti-inflammatory drugs or disease-modifying anti-rheumatic drugs (SMARDs), may be considered. 3. Oral contraceptives. Hormonal contraceptives, particularly those containing estrogen, are widely used for birth control and menstrual regulation. However, they can cause blood pressure to rise in some women. Mechanism: estrogen can stimulate the liver to produce angiotensinogen, a precursor to angiotensin II, a hormone that constricts blood vessels and raises blood pressure. Risks: women with a history of hypertension or those who are overweight may be at greater risk of developing elevated blood pressure while using oral contraceptives. Alternatives: progestin-only contraceptives or non-hormonal methods, such as copper intrauterine devices (IUDs), may be suitable alternatives for women concerned about blood pressure. 4. Decongestants. Over-the-counter decongestants, such as pseudoephedrine and phenylephrine, are commonly used to relieve nasal congestion due to colds or allergies. While effective, they can raise blood pressure. Mechanism: decongestants work by constricting blood vessels in the nasal passages, but this can also lead to systemic vasoconstriction, raising blood pressure. Risks: individuals with hypertension or cardiovascular conditions should avoid these medications, as they can exacerbate existing issues. Alternatives: saline nasal sprays or steam inhalation may provide relief without affecting blood pressure. 5. Antidepressants. Certain antidepressants, particularly selective serotonin reuptake inhibitors (SSRIs) and monoamine oxidase inhibitors (MAOIs), can have an impact on blood pressure. Mechanism: some SSRIs, like fluoxetine and sertraline, may cause blood pressure to rise due to their effects on neurotransmitter levels and vascular tone. MAOIs can lead to hypertensive crises when taken with certain foods or medications. Risks: patients on these medications should have their blood pressure monitored regularly, especially if they have a history of hypertension. Alternatives: other classes of antidepressants, such as bupropion, may have a more favorable profile regarding blood pressure. 6. Weight loss medications. Weight loss medications, including certain appetite suppressants and stimulants, can also lead to elevated blood pressure. Mechanism: medications like phentermine can increase heart rate and blood pressure due to their stimulant effects. They may also lead to increased sympathetic nervous system activity. Risks: individuals using these medications for weight loss should be cautious, especially if they have pre-existing hypertension. Alternatives: lifestyle modifications, including diet and exercise, remain the gold standard for sustainable weight loss without the associated risks of medication. 7. Hormone replacement therapy. HRT. Hormone replacement therapy is commonly prescribed for menopausal symptoms. While it can alleviate symptoms like hot flashes, it may also raise blood pressure. Mechanism: similar to oral contraceptives, HRT containing estrogen can increase blood pressure due to fluid retention and hormonal effects on vascular tone. Risks: women with a history of hypertension should discuss the risks and benefits of HRT with their healthcare provider. Alternatives: non-hormonal treatments, such as selective serotonin reuptake inhibitors SSRIs or lifestyle changes, may be effective for managing menopausal symptoms. 8. Stimulants. Stimulant medications, including those used to treat attention deficit hyperactivity disorder ADHD, such as methylphenidate Ritalin and amphetamines Adderall, can lead to increased blood pressure. Mechanism: these medications increase the release of norepinephrine and dopamine, leading to heightened sympathetic nervous system activity, which can elevate blood pressure. Risks: regular monitoring of blood pressure is essential for individuals on these medications, particularly those with pre-existing hypertension. Alternatives: non-stimulant medications, such as atomoxetine, may be considered for individuals concerned about blood pressure. 9. Immunosuppressants. Immunosuppressive drugs, such as cyclosporin and tacrolimus, are used to prevent organ rejection in transplant patients or to manage autoimmune diseases. They can have significant effects on blood pressure. Mechanism: these medications can lead to renal vasoconstriction, resulting in increased blood pressure. They can also interfere with the body's ability to regulate sodium and fluid balance. Risks: patients on immunosuppressants should be closely monitored for changes in blood pressure and kidney function. Alternatives: depending on the condition, alternative immunosuppressive therapies may be available that have a lesser impact on blood pressure. 10. Some cancer treatments. Certain cancer treatments, particularly targeted therapies and chemotherapy, can lead to hypertension. Mechanism: drugs like tyrosine kinase inhibitors, for example, sunitinib, can induce hypertension through various mechanisms, including increased vascular resistance and renal artery effects. Risks: blood pressure should be monitored regularly for cancer patients on these treatments, as hypertension can complicate their overall management. Alternatives: blood pressure medications may be required to manage hypertension in these patients, alongside careful monitoring. Conclusion: while medications play a crucial role in managing various health conditions, it is essential for patients to be aware of the potential side effects, including the risk of elevated blood pressure. The 10 medications discussed in this article: NSAIDs, corticosteroids, oral contraceptives, decongestants, antidepressants, weight loss medications, hormone replacement therapy, stimulants, immunosuppressants, and certain cancer treatments highlight the importance of careful medication management. If you are taking any of these medications and have concerns about your blood pressure, it is vital to discuss this with your healthcare provider. Regular monitoring of blood pressure and open communication can help mitigate risks and ensure that you receive the most appropriate treatment for your condition. Additionally, lifestyle modifications such as maintaining a balanced diet, engaging in regular physical activity, managing stress, And avoiding excessive alcohol and tobacco use can significantly contribute to maintaining healthy blood pressure levels. Ultimately, understanding the medications you are taking and their potential effects on blood pressure can empower you to take charge of your health and well-being. Always consult with a healthcare professional before making any changes to your medication regimen or lifestyle.